Hey everybody, this is Travis Robbins from the Physical Resilience Outlook and Robbins Rehabilitation West. I'm here with my trusty partners, Dan and Nick. And today we're going to be talking about the push-up. Probably a pretty universally understood exercise, meaning if I went to anybody on the street and said, hey, could you do a push-up for me? They're probably going to give us something close to what we're looking for, but we'll go over some proper ways to do this and some improper ways to mostly to prevent injury. But let's start off, guys. Like, why did this make the test? Like, why is being able to do a push-up important no matter what age you are? We'll go with Nick. You can take that one.
To me, it's just a good demonstration of upper body strength. But it's upper body strength. You have to still control like some strength through your trunk, your hips, all of that. So I think that's more where that looks. And then it's also nice that there's a lot of research behind the push up
Mhm.
as well.
Yeah, I like that there's no equipment involved, so my patients can't give me any excuses about not being able to do it. You just need your body and some ground, so that's good. Dan, let's just briefly discuss, even for people who know a lot about how to do a push-up, what is a push-up, and specifically the test that we do. What might make that a little bit different than a push-up that someone might do at home.
So push up, you're gonna get down on the floor. Feet are gonna be about hip width apart, hands under the shoulders, and then you want to keep your body in a straight line throughout. The only difference for ours is we use like an object under the chest, just to kind of keep the distance uniform. And you have to touch that with your chest every rep.
Nice. So I'll tell you the only push-up story that I have. The first time that I saw something similar to this was I was at a conference and they did a contest. I can't remember what they were giving away, but they had two people come up and they said, "All right, we're going to do a push-up contest." Well, how do you make sure everybody's going down the proper distance? Well, someone had to hold their fist at where their sternum would be, which is kind of what we do. We put a ball there when we do them in the office to make sure that you're going all the way down. So the rep does not count if the person doesn't get down to where about the size of a human's fist would be. That's how far you want to go down. With any of these tests, you're going to stop if you have any pain doing this. Typical areas that people are going to have pain if they do this is anterior shoulder. So most people that are having some rotator cuff symptoms or perhaps a labrum issue will have some pain in their anterior shoulder. If you're having pain with that, that becomes an issue that you probably don't want to push through just for safety concerns. That becomes more like a physical therapy patient. But for if you can do it all the way down through full range of motion without pain, then you are able to do this test. What about common errors in this movement, or maybe even a better way to do this would be what are our tips in terms of positioning? I'll give you kind of a hint, specifically the elbows or the arms when you're doing this, that you would give somebody to help them out in terms of injury prevention, Nick.
Well, you threw me off when you said elbows because I'm not
Okay,
sure what
well,
you're
I
talking
didn't mean to
about
throw you
there.
off. So if you got something
I
different
would have
going
I would
on,
have gone back to what Dan said before, like just that midline, making sure you're not like really dropping your hips way down and arching the back
okay.
or lifting the hips like up way too high.
Okay, so it should be a straight line when you look at somebody from the side, from their ear to their shoulder to their hip to their knee to their ankle. That's what you're saying there.
Yes.
Okay. I typically will tell people to keep their elbows in. A lot of times people will kind of flare their elbows or their humerus out a little bit, and that gets you into kind of internal rotation, which can cause some irritation in the anterior shoulder. So when I typically give this as instruction, I'll try to say, think about keeping your elbows close to your side, and I'll also think about your hands being on the ground, kind of screwing your hands into the ground, and that will kind of activate external rotators of your shoulder for better stabilization. Dan, anything to add in terms of technique or things to avoid to prevent injury on a push-up?
No, I think that pretty much covered all the
Got it.
things I look for.
Okay. So in terms of scoring this movement, we expect what, Dan? So we do block this out by age, like a lot of our tests. So and there's blocks of ages 20 to 39, ages 40 to 59, ages 60 to 79, and then 80 and above. As you get older, we are okay with decreasing the standards of what we would expect you to get. But in terms of getting a perfect score on this exam, so like all of our tests, you get a score of 0 to 10. To get a 10, how many push-ups would you have to do for men?
So in the youngest age group, the goal for a perfect score is 50. And then it kind of goes down by 10 for every age bracket. And then for women, it's typically about half the reps of the men. And there is a couple research studies out there looking at that and how it predicts like cardiovascular health and overall health.
Nice. So 50 push-ups for a male the age 20 to 39. I wonder what's the percentage of males that would do that. That's interesting. So yeah, so at the very top of that range would be 50. In order to get any kind of score at all, like not score a zero in the ages 20 to 39, you're going to have to be able to do 5 push-ups for men. So you guys, if you're listening to this right now, you'll have access to the charts that we have so that you guys can score this yourself at home. We talked a little bit about why this is important. Nick said it's a good expression of upper extremity strength. Dan, do you have anything to add to kind of a sales pitch to someone to be like, yeah, if you can only do a few push-ups, you might want to work on that a little bit. What is the importance of the push-up?
Yeah, outside of upper body strength, it kind of gives you like a rough estimate of like just how your like overall body weight is. Generally, heavier people are going to have a harder time with push-ups because it is in pretty much any body weight exercise. So you might have like good upper body strength, but if you have like extra body weight you're holding on to, that's going to make you do worse on the test. It also has a good correlation with like cardiovascular health in the research. So that's another good reason to work on it.
Yeah. And Nick, same kind of concept. I kind of have an idea what you're going to say, but why we lose this as we age and the negative consequences of losing this as we age are what?
Well, some of it is going to be muscle mass, right? So when we're just not being able to use our upper bodies and stay strong, we're going to have some of that loss of muscle mass just from that. But here, I look at the push up as actually pretty practical. Like I just had a patient recently, right? But it's like pushing off of like to get up from bed, to get up from a chair. So it's like there are a lot of circumstances too in which like you're kind of pushing around to get yourself around, and that's even outside of other things where we talk about like getting up from the floor. Yes, we want to be able to get up from the floor with using as little points of contact as possible, but sometimes we're going to be pushing ourselves around. So it also has that practical standpoint of anytime your hand is in contact with something that's not moving and you're pushing yourself away from it in some way, yeah, you want to be able to do that and have it not basically pinch your shoulders and cause other problems too.
Yeah, I think about too. Might say, well, I don't know how much I need to focus on doing a push-up, but even getting down onto the floor, you're going to have to support your weight on something with your upper extremities for the most part. If you want to get underneath your table or pick something out from underneath your bed, people that are listening to this that are in their 20s are like, well, that doesn't make any sense. I can do that easily without using my hands at all. But at some point, if you don't have this strength, it becomes a situation where you can cause an injury if you're not stable and able to do that as you get older. Equipment needed, not much to talk about here, just kind of floor space and your body. So that's like we said at the top of the call, is a huge advantage in terms of being able to do it. Scores mean we've kind of talked about that. If you're scoring low here, you can probably get away with doing lots of things in daily life, but at some point, you're going to really want this skill. It might not be on a daily basis, depending on what your activity is, but your scores mean that you are just a less strong human being, and all the research points to muscle size and strength being really important as you age. But you're just less resilient. If you can do a lot of push-ups, then you're going to be more resistant to bad things happening to you. Systemically, I feel, but also just orthopedically and like ability to move around. I think it's a huge thing that people is common to neglect. Like if you talk to somebody that's in their 50s and 60s, and when's the last time you saw how many push-ups you can do? Like your max number of push-ups. I'm gonna bet that very few of them would be able to give you an answer that was recent.
It
But
was
I'm
in
gonna
high school.
yeah, it's now as I go into my treatment schedule this afternoon, I think I might ask my patients that, even though they might be coming in for a lower extremity injury, I'm still going to ask them and see what they say. But yeah, it's something that is easy to lose because unless you're doing, the what was that in gym class? Did you guys do that when you were in gym, or was
Presidential
it like
fitness test.
there you go? Yeah, Dan, did you do that in high school?
Yeah, that was still around.
Yeah, I think part of that was a push-up test. It's been quite a while since I've done it, but it was like a max number of push-ups. That might be the last time that people have trained that. So I'm gonna have to ask that question. Improving this movement. So when you do your test and you get a score, if it is not 10, then that's something that we're going to give you programming to do. So this movement obviously very easily lends itself to just working on that actual movement. But Dan, what are other things that people can do in order to improve their push-up number?
You could definitely use like dumbbells and free weights if you have access to them to do like shoulder and chest strengthening stuff. I think one thing a lot of people can work on to improve this is different like core exercises. Actually, I think a lot of people fail more because of the core than the chest. Just holding that midline position. Um, and like I know a lot of people do like knee push-ups to build up to it, but not really a big fan of those because you don't get that same core engagement and feel like you never end up making progress. So you're better off like elevating the hands on like a chair or a table and starting that way, making sure that core is engaged, and then gradually lowering the surface height as you go.
Okay, so that looks like just finding a table or a couch that's not going to slide out from underneath you and just elevating your push-up versus being on the floor. So if you guys can visualize that, it's the same exercise except your hands are further away from the floor than they were than in a true push-up. So that's a good way to do that. If someone was could only do maybe one or two push-ups, kind of where would you start them? Would you start them with just some basic weight bearing into their upper extremities and doing a plank on the floor, elevated plank? Would you suggest that they do that elevated push-up or a combination of both, do you think?
Yeah, probably some combo of like a plank on the floor and then maybe a little elevation for the push-ups so they can get like a good 6 or 10 reps instead of just one or two each set.
Yeah, we in the world of physical therapy talk a lot about weight bearing exercises. So there's some things that we do on a table, but for the most part, in order to hit your goals that you're trying to get, and the reason that you're in physical therapy is because it's stopping you from doing something. We want to try to get you off the table for the most part, as much as possible. Do weight bearing exercises because you're spending most of your life weight bearing, not laying on a table. I think sometimes weight bearing exercise in the upper extremity are kind of missed because it's usually some open chain stuff. Whereas closed chain, like just planking, doing an actual push up, doing different movements while in weight bearing position on your hands, can be super important for a lot of different reasons. But especially if you're struggling with push ups, just spending some more time with weight bearing into your hands can be advantageous. Anything to add to that, Nick?
No, I think that's the biggie is like, hey, where we talked about a lot of these is like sometimes just get down, start doing stuff. And that's going to have a lot of carryover into both this movement and others.
Yeah. And the last sales pitch I'll get is you just want to be able to do a bunch of push-ups, right? If you got grandkids and they want to ask grandpa or grandma how many push-ups they can do, you want to be able to do that. That's something that's a skill that you want to have. So if you've listened to nothing else has motivated you, it's just good to be able to do a bunch of push-ups. Am I right? Yeah. All right. Thanks, guys. Thanks for your time. Thanks for explaining the push-up. And as always, we'll continue to put out more education like this. And what do we say at the end, Nick? Better health through better
There it
understanding. All
is.
right. I thought Nick was going to get it that time. He thought I was going to forget it. All right, guys. Thanks for listening, and we'll talk to you soon.